Recently, a new zoonotic virus has spread rapidly across several countries, causing thousands of infections and raising global concern. Although scientists have successfully developed a vaccine, not every country has the technology or resources to produce it. As a result, many developing nations still struggle to provide vaccines for their people. This situation raises an important ethical question. Should developed nations share their vaccine technology to protect global health and prevent future viral mutation? Today, we will explore this issue through a series of dialogues based on real-life situations.
Today we will discuss the ethics of global vaccination. Imagine a new zoonotic virus suddenly spread around the world. Scientists quickly develop a vaccine, but only a few developed countries have the technology to produce it. This raises an important question. Should developed nations share their vaccine technology with other countries? Before I answer the question, let's understand how vaccines work. First and foremost, vaccines provide artificial active immunity. They contain harmless forms or parts of a pathogen that stimulate our immune system without causing disease. When we are vaccinated, our body activates B cells and T cells. B cells produce antibodies while T cells destroy infected cells. Most importantly, both produce memory cells which remember the virus for future protection. Exactly, if the same virus into our body again, these memory cells respond much faster. This means our immune system can fight the virus before we become seriously ill. This is why vaccination is one of the most effective ways to prevent infectious diseases. Now let's look at the ethical issue. We believe that developed countries have a moral responsibility to share vaccine technology because every human life has equal value. If only rich countries have access to vaccines, millions of people in poorer countries may remain unprotected. So this creates global health inequality. In addition, virus doesn't respect national borders. If many people remain unvaccinated, the virus continues to spread and reproduce. Every time the virus reproduces, there is a chance that it will mutate and create a new variant. Some new variants may spread faster, become more dangerous, or even reduce the effectiveness of existing vaccines. This means even countries with high vaccination rates are still at risk. Therefore, sharing vaccine technology is not only an act of kindness, but also a smart strategy to protect the entire world. The more countries that can produce vaccines, the faster people can be vaccinated. When a large percentage of the world population is vaccinated, herd immunity can be achieved. Herd immunity reduces the spread of the virus and protects vulnerable groups such as babies, elderly people, and individuals with weak immune systems who cannot receive vaccine. Besides sharing vaccine technology, developed nations can also provide financial support, scientific expertise, medical equipment, and training to developing countries. This efforts strengthen global healthcare system and improve preparedness for future pandemics. Some people argue that developed countries invested billions of dollars in research and should protect their patents. While this concern is understandable, during a global health emergency, saving lives should be the highest priority. Temporary cooperation can help reduce unnecessary death and shorten the duration of the pandemic. In conclusion, developed nations should share vaccine technology because it promotes fairness, protects global health, reduces viral mutations, and help achieve global herd immunity. Working together is the most effective way to fight a pandemic. As the saying goes, no one is safe until everyone is safe. Thank you for listening. Thank you.
Today we're reporting live news with the Director General of Health about preventing future outbreaks. So here we have Dr. Farah. Good afternoon, Dr. Farah. Thank you for joining us today.
Good afternoon, Joshua. Thank you for having me today.
So the recent outbreak has raised concerns across the country. What measures are being taken to prevent another outbreak?
Our priority is strengthen disease surveillance, expand vaccination program, and educate the public about preventive measures. Vaccination provides artificial active immunity, helping the immune system develop memory B cell and T cell to fight future infection more effectively.
So, what other roles does the public take in controlling the spread of the virus?
The public plays a very important role. Everyone should get vaccinated, practice good personal hygiene, wear masks when necessary, and stay home if they feel unwell. This simple action can greatly reduce virus transmission.
So, what about some people are still hesitant to get vaccinated? What would you say to them?
Vaccines are safe and effectively. They not only protect individuals from severe illness, but also help to protect the community by reducing the spread of disease and supporting herd immunity.
And what is your final message to the public?
We all have a responsibility to protect ourselves and others. By working together and following public health advice, we can prevent future outbreaks and create a healthier society.
So that's all from us. Thank you, Dr. Farah, for sharing your valuable insights.
Thank you.
Now we're recording live with the WHO representative about global vaccination and preventing future outbreak. So with me here is Dr. Zila. So good afternoon, Dr. Zila. Thank you for joining us today.
Good afternoon. Good afternoon, Joshua. I'm pleasure to be here.
So many countries are still struggling to control the spread of the virus. What is the WHO's recommendation?
The World Health Organization encourages all countries to work together by increasing vaccination coverage, sharing scientific knowledge, and improving public health system. Global cooperation is essential to control future outbreaks.
So regarding on many developing countries still have limited access to vaccines, what should developing nations do?
The developed nations have a moral responsibility to share vaccine technology, manufacturing expertise, and medical resources. Equal access to vaccines is important because everyone deserves the opportunity to be protected.
So doctor, why is vaccine sharing so important?
If large population remain unvaccinated, the virus will continue spreading and mutating. The variants may become more contagious or resistant to existing vaccines. And sharing vaccine technology helps reduce this risk and protect the entire world.
And can global vaccination really prevent future outbreaks?
Yes, when more people receive vaccines, we move closer to achieving global herd immunity. This reduces transmissions, protects vulnerable populations, and lowers the chance of dangerous viral mutations.
Okay, so last but not least, what message would you like to share with the people around the world?
A pandemic is a global challenge that requires a global solution. By supporting vaccination, sharing vaccines technology, and working together, we can live and build a safer future for everyone.
And thank you, Dr. Zila, for sharing your thoughts with us today.
Thank you. Together, we can make the world healthy and safer. Thank you.
Dr. Mida, about preventing future outbreak. Good afternoon, Dr. Mida. Thank you for joining us today.
Good afternoon. It's my pleasure.
So the recent outbreak has worried many people. What's the government plan to stop the virus from spreading any further?
Our main strategy is to increase vaccination coverage, improve public awareness, and strengthen disease surveillance. Vaccination helps people develop artificial active immunity, reducing severe infection.
And what can the public do to help?
Everyone should get vaccinated, maintain good hygiene, wear masks when necessary, and stay home if they feel unwell. Public cooperation is essential.
And how many developing countries still don't have enough vaccines? And what should be done?
Developed nations should share vaccine technology, scientific knowledge, and manufacturing expertise. Every country deserves equal access to life-saving vaccine.
And why is this so important?
If large population remain unvaccinated, the virus will continue spreading and mutating. New variants may become more dangerous and threaten the entire world.
And global cooperation is the key.
Absolutely. By sharing vaccine technology and ensuring equal vaccine access, we can achieve global herd immunity, reduce viral mutation, and save millions of lives.
Finally, what's the message that you would like to give to everyone for the rest of the world?
Remember this, a virus doesn't stop at borders, so neither should our effort to fight. Together, through vaccination and global cooperation, we can build a healthier and safer future.
And that's all from us. Thank you very much, Dr. Nida.
Thank you, stay safe.
Going back live from news with Dr. Aida to talk about the latest reports about the outbreak. So, good evening, Dr. Aida. Thank you for joining this meeting. Could you update us on the current situation?
Good evening, Joshua. Based on the latest hospital reports, we have confirmed several new cases of this zoonotic virus. Most patients develop symptoms such as fever, cough, fatigue, and difficulty breathing.
So, have you been noticing any changes in the virus?
Yes, our laboratory team has observed possible mutations in some virus samples. We have already sent these samples to the National Laboratory for further analysis.
And what actions do you need to recommend?
First, we should increase vaccination coverage because vaccines provide artificial active immunity by stimulating memory B cells and T cells. Secondly, we need to strengthen disease surveillance and encourage early testing. Finally, we should continue educating the public about hygiene and infection prevention.
So, in your opinion, Dr. Aida, do you think international cooperation is still necessary?
Absolutely. If developing countries continue to face vaccine shortages, the virus will keep spreading and mutating. Developed nations should share vaccine technology and medical expertise to ensure equal access to vaccine worldwide.
Thank you, Dr. Aida. Your report will help us improve our national response. We will also work closely with international health organizations to prevent future outbreaks.
Thank you, Joshua. I hope our combined efforts will protect more lives and prevent another global pandemic.
Ultimately, vaccination is one of the greatest achievements in modern medicine. However, vaccines can only protect the world if they are accessible to everyone. By sharing vaccine technology, strengthening international cooperation, and ensuring equal access to vaccines, we can reduce viral mutations, achieve global herd immunity, and save countless lives. Remember, no one is safe until everyone is safe. Thank you for watching.